My name is Dr. Terry ALANI. The name of my practice is Terry ALANI DDS, and I practice in Houston, Texas. The Snap-on Smile appliance is really changed my practice. It is an appliance that is customized, it's reversible, it requires no anesthesia, it requires no solutions or gels to keep it in place, and has really transformed a lot of my patients' lives. I've been doing it for probably 5 years now, and I have had really great results with it. The best candidates are those that have smaller teeth, and of course in a more ideal occlusion and alignment. Those patients that have teeth that are protruded or flared are not going to be your best candidates because the appliance adds thickness and then it becomes a little bit too bulky. So you have to be really, really careful in your case selection. That's really, really important. Of course, if they have active decay or periodontal disease, they won't be a good candidate. We have so many people that come into our practice asking for Snap-on Smile, and I would say of the patients coming in that are asking for Snap-on, probably around 75% of them want it just for an aesthetic appliance. The rest, they either do it as a transitional appliance to transition maybe into veneers later. We do some appliances when we're doing implants as a temporary, and also one of our best treatment solutions is for people that have partials and they want a replacement, so we use Snap-on Smile for that also. We're changing patients' lives and giving them more confidence in themselves, because for some of these patients there is no other solution. They simply cannot afford the cost of more comprehensive dentistry such as veneers or implants. So we're doing a valuable service. The other thing is that many of these patients that come in, they need to have a deep cleaning. They need to have some fillings taken care of. And so it also generates a revenue because we are doing treatment to get them prepared for the Snap-on Smile. So it has been very beneficial and productive in our office. I don't know how they cannot practice without doing Snap-on Smile. I promise you, if a patient walks into an office and they do not offer Snap-on Smile, and that's what that patient is looking for, they will go to another dentist and seek a dentist that does do Snap-on Smile. This provides them an option where they can actually walk out of the office feeling really good about themselves, and you'll feel good about yourself too because you provide a great service for a patient. In dental school, we're taught more traditional dentistry, crowns, implants, veneers, and it's very difficult for us to think of a temporary appliance, and Snap-on Smile is a temporary appliance. I think of it as an accessory. And it's difficult for most dentists to think that this is an adequate solution for the patient, but it is. First thing a dentist can do is open up their mind and realize this is an incredible alternative to other types of dentistry. The second thing is to educate your staff. Have brochures, have pamphlets out in your waiting area. Have your staff excited. Maybe make a Snap-on Smile for yourself or your staff, and encourage other staff members to talk about it to their patients. If you are going to start doing Snap-on Smile, DenMat is very helpful with their consultants in their lab in guiding you and helping you get through your first case. One of the most important things I would like to relay to the dentist is to make sure the impressions are accurate. Just like you would on crown and bridge, when you send it to your lab, no voids, no tears. You have to make sure that everything you're doing on your end is going to allow the lab to make a consistent, superior appliance that's going to make your patient walk out happy. So I think if dentists could act like dentists and think like a patient, I think it would make a big difference in a patient's lives, because you have to realize we're here to take care of our patients. And even though that we are taught that permanent restorations are the best way to go, I agree with that, and that's the way I practice my dentistry, but there are those patients that simply can't afford it. So we offer the Snap-on Smile, and it has been one of the most rewarding things I offer to my patients.